scalp for any abnormalities, lesions, or depressions. I do not feel any abnormalities, lesions, or depressions, so I'm going to move on to your sinuses. I'm going to check your maxillary and your frontal. So you tell me if you have any pain or tenderness when I'm palpating.
Yeah.
Okay. And I'm going to percuss your maxillary and your frontal, and I was just feeling for any fluid. Next, I'm going to check your trigeminal nerve, which is cranial nerve number 5. So I'm going to have you close your eyes and tell me when you feel this. It's your sensation nerve.
No.
Okay, and cranial nerve number 7, which is your facial symmetry nerve. I'm going to have you smile real big and puff out your cheeks. Okay, good. Thank you. Next, I'm going to move on to your eyes. First, I'm going to make sure they're symmetrical with your face, and they are. And I'm going to check your pupils to make sure they're equal, round, and reactive to light. So if you could just look at me, please. Okay, good. And I'm going to have you look at my pen, the wall behind me, and back at my pen. I'm just checking for accommodation. Okay, and they accommodate. I'm also going to check your conjunctiva and your sclera. So I'm going to have you look up. Your conjunctiva is pink and moist, and down. Your sclera is white. Okay, I'm going to move on to, well, we already checked your optic nerve number 2, which was, or cranial nerve number 2, which is your optic nerve, and that was on the Snellen chart. So I'm going to move on to your nose. And your nose is symmetrical with your face, and I'm going to go ahead and check your nose for deviated septum and make sure the mucous membranes are pink and moist with no lesions or anything. So now you look up, and they're pink and moist and no deviated septum. And I'm going to check the patency. So I'm going to have you sniff, and there's no blockage. Also, I'm going to have you flare your nostrils. Okay, good. Thank you. Okay, I'm going to check your mouth. Your lips are pink and moist. They're not dry or cracking. So I'm going to have you open your mouth. Say ow. And your mucous membrane is pink and moist. Your tongue's pink and moist. Can I have you lift up your tongue? Move left to right. Okay, and I'm checking just to make sure there's no sores or lesions or white patches when there's not. And I'm having you say "oh" one more time. Your uvula is in line or symmetrical with the rest of your body. Your teeth are white and your gums are pink and moist. So I'm going to move on to your ears. I'm going to palpate your ears, and you tell me if you have any pain or tenderness. Any pain or tenderness?
Nope.
Okay, I'm going to look and see if there's any discharge. No discharge. Check this side. No discharge. Okay. I'm also going to check your cranial nerve number 8, which is your hearing acuity. So I'm going to have you put your finger in one ear, and I'm going to whisper in the other and have you repeat after me.
3, 4, 5,
And the other side.
7, 8, 9.
Okay, thank you. I'm going to move on to your neck, and I'm checking to make sure that your thyroid and your trachea are in line, and they are. I'm also going to palpate, and you tell me if you have any pain or tenderness. Is there any pain or tenderness? Okay. I'm going to auscultate or listen to your carotid to see if there's a bruit, which a bruit is if there's a occlusion or a blockage, or if there's a stenosis, which is narrowing of the arteries. So just breathe normally. Okay, and there was no bruit. Okay, I'm going to go ahead and check your cranial nerve number 11, which is your spinal accessory nerve. So I'm going to put my hands here and have you push, and push, push. Thank you. I'm going to move on to your anterior thorax, and I'm going to be checking your skin for any temperature or any excessive moisture. I don't feel any temperature or excessive moisture. I'm going to go ahead and listen to your, or have you take a deep breath first. Okay. You're not, I was just checking to make sure you're not breathing with your pectoral muscles or one side more than the other, so it was bilateral. I'm going to go ahead and listen to your lung sounds, and I'm just checking to see if your lung sounds are clear or not. circular motion around the breast towards the center, and you squeeze the nipple, and you're just checking for discharge. So if you have any pain or tenderness, any discharge, just need to contact your primary care physician and have a more thorough exam done. I'm going to move on to your posterior thorax. I'm going to move around to your back and just listen to your lung sounds like I did on the front, and to check and make sure there's no spinal abnormalities. Okay? Okay, I'm going to have you take a deep breath. Okay, lung sounds were clear with no adventitious breath sounds. And I'm going to go ahead and have you lean forward and lean your head down, and I'm just checking the spine to make sure that it's in line and there's no abnormalities like kyphosis or scoliosis, which I do not feel. Okay, I'm going to go ahead and check your upper extremities. So maybe pull your arm sleeves up. And I'm just feeling to make sure there's no temperature, to make sure that there's no excessive moisture. And I'm looking at your fingers. We're going to do capillary refill, and we're just going to squeeze your finger lightly and make sure it's less than 3 seconds, and it is. And I see no clubbing on the fingers. I'm going to check your pulses, your radial pulses. They're bilateral and symmetrical, and your brachial. They're bilateral as well as symmetrical. I'm going to check your skin turgor. So I'm just going to pinch lightly, see if there's any tinting. There's no tinting and no tinting. Okay. I'm going to also check your deep tendon reflexes. So this is your brachioradialis, if you just relax, and your bicep and your tricep. We're going to do it on this side. Okay, thank you. And we're going to do range of motion. So I'm going to have you follow me. So arms out, which is abduction, flexion, extension, and abduction. Okay, thank you. And I'm going to go ahead and have you lay back so I can check your abdomen. Okay. First, I'm going to check for contour and symmetry. So I'm going to have you take a deep breath. Okay, you can let it out. Your abdomen is smooth, the contour is smooth, and it's symmetrical. You're not breathing with just one side. So I'm going to go ahead and listen to your bowel sounds, and this could take up to 5 minutes. Okay. We listen in each quadrant. There's 4 quadrants. The right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. And what we're listening for is just to make sure, see if they're hyperactive, hypoactive, absent, or audible, and yours are audible. So that's good. Now I'm going to go ahead and palpate. So I'm just feeling for any masses, but you tell me if you have any pain or tenderness as well. Any pain or tenderness? No? Okay. I'm going to go ahead and move on to your lower extremities. And I'm going to check for, I'm checking to make sure there's no temperature. So we're checking for warmth or excessive moisture. I'm going to check your pulses bilaterally to make sure they're symmetrical. Your femoral, your popliteal, your dorsalis pedis, and your posterior tibialis. Okay, and they were all bilateral and symmetrical. So I'm going to test your strength. So I'm going to have you push, push, okay, and I'm going to lift up your legs and have you push down. Okay, good. I'm going to check your range of motion. So I'm going to have you relax your leg and then lift. This is flexion, extension, abduction, adduction. I'm going to do this side. Relax your leg, flexion, extension, abduction, and adduction. Okay, good. All right, we're going to go ahead and check your capillary refills. Okay, they blanch back within 3 seconds. And I'm going to check your deep tendon reflexes, your coronus, which we're just going to have you lift up your leg and relax, flat your foot, okay? gonna go ahead and check your joints. Okay. And now I'm gonna finish checking your deep tendon reflexes. So I'm gonna check your popliteal, your Achilles, and your plantar. I'm also going to check the neurological sensation on your arms as well. And this is sharp and this is dull.